Second white coat. Subscribe and like. Let's learn medicine together.
All right, welcome. Today we're going to put on our detective hats and solve a real-life medical mystery. We've got a patient, some really strange clues, and a diagnosis just waiting for us to piece it all together. So you ready? Let's dive in.
So our whole investigation kicks off right here with what the patient is telling us. This is the problem that brought her in. Blurred vision and pain when she moves her eye. You know, right off the bat, that tells us this is probably not just a case of needing new glasses. There's something active, something inflammatory happening here.
You know, every good investigation starts with getting the backstory, right? To figure out what's going on now, we've got to look at who our patient is and what her history can tell us.
Okay, here are the key facts. She's a 34-year-old woman, and that demographic is a clue in itself, actually. MS is most common in women between 20 and 40. But here's the real kicker. She's had a previous weird neurological thing happen, an episode of double vision that just kind of went away. That tells us today's symptoms aren't just a random one-off event.
And check this out. This timeline really lays it all out for us. 2 years back, she had this weird episode of double vision, and then it just, poof, went away on its own. But now, today, she's got this totally new thing going on with blurred vision and pain. In the medical world, this has a name. Dissemination in time. You hear that? Problems separated in time? This isn't just a coincidence. No way. This is a huge, flashing neon sign of a clue.
So, if we lay all our clue cards on the table, what do we have? We've got a young woman, we've got two completely different neurologic events separated by a couple of years, and this is so important. They're affecting different parts of her nervous system. That double vision, that points to the brainstem. Today's eye problem? That's the optic nerve. This is what we call dissemination in space. It's another huge piece of this puzzle.
Okay, so let's zoom in on what's happening right now. Our first big physical clue comes from her eye exam. The condition she's experiencing is called optic neuritis, and wow, is it a classic sign of what we're looking for.
Now, what's so interesting here is just how specific these findings are. The pain tells us there's inflammation. The reduced vision, well, that's pretty obvious. But this afferent pupillary defect, what that means is the pupil in her bad eye isn't tightening up like it should when you shine a light on it. It's a dead giveaway that the nerve signal is getting blocked. See? These aren't just symptoms she's feeling. They are real, measurable signs of nerve damage.
All right, we've looked at her history, we've seen the physical signs. Now it's time for our second major clue. We're going to look directly inside her brain and spinal cord. It's time for an MRI.
So the report comes back from the radiologist, and it's full of this really technical language. Multiple ovoid white matter lesions oriented perpendicular to the lateral ventricles. I know, it sounds like a mouthful, but that very specific description, well, that's the key that's about to unlock this entire mystery.
And believe it or not, that technical description points to something so specific it has its own name, Dawson fingers. These lesions, these little areas of damage, they literally point out from the fluid-filled spaces in the center of the brain like fingers. And that pattern, I mean, it's practically a radiological stamp for multiple sclerosis. It's an unbelievably strong piece of evidence.
So let's just step back and look at everything we have. A young woman, two different neurologic problems separated in both time and space. She's showing up with classic optic neuritis, and her MRI shows those telltale Dawson fingers. What do you think? I mean, the evidence is pretty much shouting the answer at us.
The diagnosis is multiple sclerosis, or MS. Case closed, right? Well, not quite. Putting a name to it is just the beginning. To really get what's happening to our patient, we need to ask the next question. What is MS?
Okay, so MS is an autoimmune disease. What that means is the body's own defense system gets confused, and it starts attacking healthy parts of itself. Specifically, it's a demyelinating disease, which means it attacks the protective insulation around nerves. And, this is key, it only happens in the central nervous system. We're talking about the brain and the spinal cord.
So, let's zoom way in, from the patient as a whole down to the microscopic level. If the immune system is on the attack, what's its target? We need to take a look at the cellular battleground.
The number one target in MS is a very specific kind of cell called an oligodendrocyte. Here's a good way to think about it. Imagine your nerves are like electrical wires. The myelin sheath is the plastic insulation around those wires, while oligodendrocytes are the little factories that make and maintain that insulation, but only inside the central nervous system.
So here's how the attack actually goes down. First, these rogue immune cells called T cells kick everything off. They're like the generals, starting the inflammation and calling in the troops. Those troops, macrophages and microglia, are the ones that do the physical damage, literally stripping the myelin insulation off the nerves. And the end result is that both the myelin and the oligodendrocyte factories get damaged or destroyed.
But hold on a second. Aren't there other diseases that cause nerve damage? Of course there are. So how can we be so sure this is MS? Any good detective has to rule out the other suspects.
And this is where the details are absolutely critical. MS is a disease of the central nervous system, where those oligodendrocytes make the myelin. Now compare that to something like Guillain-Barré syndrome. That condition attacks the myelin in your peripheral nerves, the ones in your arms and legs. And guess what? That myelin is made by a totally different cell, called a Schwann cell. It really all comes down to location, location, location.
Okay, so let's break down the players in this cellular drama, because it's actually pretty fascinating. Think of it like this. The oligodendrocytes, they're the primary target, the victims in this whole thing. Then you have the microglia. They're the attackers, the ones actually doing the damage. The astrocytes, they're kind of like the scar tissue cleanup crew. They come in after the battle and form the sclerosis part of multiple sclerosis. And Schwann cells, well, they're not even in the movie. They're off in a totally different neighborhood, the peripheral nervous system, so they're not involved at all.
Whew, we've covered a ton of ground here, right? We've gone from the patient's symptoms to her MRI, all the way down to the cells themselves. So let's boil this entire medical detective story down to one singular, powerful takeaway. And here it is, the whole case, wrapped up in a nutshell. The clinical clues, that's the optic neuritis and the past problems, plus the X-ray clue of Dawson fingers, it all points to one thing, MS. And MS, at its core, is an autoimmune attack on the central nervous system's myelin, which is made by oligodendrocytes. It's a perfect summary. You know, the real takeaway isn't just the diagnosis, but how we got there. It makes you wonder, what other diseases are hiding their secrets, not in a single blood test, but in a pattern of clues woven through time, space, and the very images of our own brains?